Alright, hello, my name is Ashton Preston and I'm going to be presenting my instructional plan final project for motor control and learning. And let's just start with a brief overview of what I'm going to be talking about today. The goal of the instructional plan right now is to teach my learner, who I'm going to introduce here in a little bit, how to perform a pirouette turn. A pirouette turn is a basic step of ballet dance, which I'm very familiar with. And me as an instructional person, this would be very similar to something that I would do in a day-to-day activity, teaching a learner how to do this really basic turn. So just to lay out an overview of the presentation, we're going to start with a diagnosis of the learning experience. That's where I'm going to introduce my learner, talk about the target skill, talk about the characteristics of the target skill, things of that nature. I'm also going to be providing an instructional plan for how I'm going to approach this learner and teach her this very basic skill, and hopefully we'll be successful at the end. Then I'm also going to give a couple of modifications just in case she's either not progressing correctly or she's progressing at a rate faster than what I initially thought, so that we can give her a couple of alternatives to either improve more so than our initial target or to get her back on track to our initial target. So let's begin by introducing my learner. This is based on a real-life person that I actually met a couple of years ago when I was dancing. This is pretty similar to a real-life story. So Sarah is a 28-year-old woman who has always wanted to study the art of ballet. A fundamental step of ballet is the pirouette turn. Sarah has only been a student for 2 weeks and she's not yet mastered this pirouette turn, so theoretically she would have came to me seeking additional help, and she would be my learner and I would be the instructor in this case. This is a picture of Sarah. She's pretty similar to a real-life person. This is based pretty much on a real-life person. This is a short video actually from the Lexington Ballet here in Kentucky of a pirouette turn. They give a full-length demonstration, but I'm just going to show a short clip.
Welcome everyone, my name is Luis Dominguez. I am the artistic director with the Lexington Ballet in Lexington, Kentucky, forabout.com. What we would like to do for you today is to show you how to pirouette.
Okay, and that was a pirouette turn. It's a pretty basic step. You would find it everywhere in a common ballet practice in any studio that you go to, or any dance-related performance or anything of that nature. You would run into a pirouette turn. This is very common. Any dancer, anybody familiar with dance can recognize that as a basic step. So let's move on to the diagnosis of the learning experience. We're going to talk about, first of all, Sarah a little bit more in depth on her learning characteristics. Sarah, and this is pretty much parallel to real life, she has no previous dance experience, but she's also physically fit with no known handicaps. She's really motivated to learn the pirouette turn. Again, this is a basic step, something that she'd be highly interested in learning if she's going to continue pursuing dance as an art on a regular basis. Sarah is equipped with an average set of abilities for skilled turning, and that would be such multi-limb coordination, which she would need to execute the turn. Balance and with visual cues, again, a very major component that she would need to execute the turn. Perceptual timing and force control. Sarah is also in the verbal cognitive stage of learning. She's not in the motor stage of learning because she is not yet to the point where she's working on skill refinement. So a lot of what we would be talking about, should I ever teach someone like Sarah, we would be discussing verbally what the task is, how to execute the task, more thinking about the task itself rather than execution, because she is trying to master it mentally as well as physically at this point, because it's a completely new and unfamiliar skill to her at this time. Alright, goals of learning. Sarah's learning this new skill in a controlled environment. She would be learning it in a dance studio. It would be something that we would be able to control. It's not an unpredictable environment. It'd be the same thing every day, day in and day out. The immediate goal then is going to be program learning, because we're trying to teach her this new skill. A basic pirouette turn in ballet is a step that requires not a lot of variation, so parameter learning is not a main goal, because she does not need to account for a lot of variation in the turn, because she is just learning the basic step and not really focusing on how to alter it at this time. She does need to be able to generalize her performance though, because though we're in a controlled environment in a practice setting, at one point, hopefully, Sarah would like to perform, so she needs to be able to generalize that goal of being in a practice situation to being in a performance situation where she would be able to alter the turn if she needed to. Skill refinement is not really a major goal as of right now because, again, this is a completely new skill that Sarah is totally unfamiliar with, so we're not really working on the perfection of the skill. We're more working on getting the skill executed correctly in a way that is successful, but not to a point where we're at skill mastery. Sarah is also going to continue working beyond this point on error detection and correction. This is a really important thing that I would, as a dance instructor, be focusing on. A lot of what dance instructors like to do is they like to teach their students how to detect those errors on the student's own time. Like, you don't want to hand the student everything because they're not learning anything from that. So should Sarah attempt to execute the turn, she's not successful, we want to be able to ask her, well, what about that was wrong? We want her to be able to learn how to correct the turn on her own without us just giving her all the information. So, though we will be hand-holding her a lot in the beginning, later on we want more error detection on her own time. Characteristics of the target skill. The pirouette turn is a serial close skill that involves mostly large muscle groups. It's not a very tedious, discrete skill. It does have a definite beginning and end, but it's a little more complex than what we would say a discrete skill is. Speed accuracy trade-off, and it's mostly temporal because it's time related, not really spatially related. We really need to consider that because though we want Sarah to eventually be able to turn quickly, at this time she's not going to be able to do it and be accurate. So what we want is her to slow the turn down so she could be more precise in her execution and the movement's going to be more accurate. Initially this is a cognitive skill rather than a motor skill. Later on it's going to become a motor skill because we are going to be focusing on that quality of the turn. But right now initially we're just working on the cognitive, what is the skill, how can I execute the skill precisely. Because this is just dance and a body, it's no manipulation of objects. We don't have to focus on a ball or a bat or anything like that. The skill also requires an open loop control, more specifically a specific motor program. It's not really anything generalized where she has a lot of leeway. It's very specific executed movement. It's done the same way, the same time, every day. It's very basic, something that I would consider a fundamental of dance. It requires mostly response selection and programming. The stimulus, we could argue, is the music, should she be dancing, but there's not as much of a stimulus as, say, a batter hitting a baseball. The ball's coming towards him, that's his stimulus. In dance, it's more about deciding the skill you're going to be executing, how you're going to select the response to the skill you're executing, and making your body execute that skill. So there's not as much of a stimulus involved in this kind of skill. There is a low risk for injury at this time because though this is a complex movement, it's not necessarily a high risk movement, it's very basic. So as long as Sarah uses the correct muscles and mechanisms, she's not going to be at high risk for injury. Nature of the target context. The turn is going to occur in a competitive setting because it is athletically based and it would be later on performed in a performance setting. So at this time it's a competitive setting. Time can also be considered a context because Sarah may only have so many musical counts to complete this turn. And what I mean by that is in dance and in music, you have a 5, 6, 7, 8. So Sarah may only have the 7, 8 to do the turn. So that might be a constraint she runs into later on that we might have to deal with. Sarah may also feel pressure or anxiety due to performing in front of others. It's very common, especially when you're a new dancer, and Sarah, technically speaking, is an older dancer, so she might feel a lot of pressure or anxiety to perform at a level that her younger classmates may be performing, which can be distracting to her learning. So we also have to consider that in our target context. Alrighty. Moving on to the design and delivery of our instructional plan. Practice manipulations. We already talked about the target skill, the goals, and the context. Obviously, the target skill is the pirouette turn. The goal is that Sarah wants to be able to successfully execute that pirouette turn. And the context right now, we're saying, is in a dance studio. Should I be teaching Sarah, I would begin by providing instructions and demonstrations. So verbally, I would instruct her the basics of how to do the turn. I would say you put your arm here, this arm here, your leg here, and you push off in this leg and you execute the turn. And after providing those verbal instructions, or even coinciding at the same time, I would be physically demonstrating the turn so that she's able to visually see and also verbally understand what I'm trying to get her to do. The type of practice would be constant and blocked. We don't want a lot of variation in this initial stage of learning because it's going to overwhelm her and she's not going to get that initial fundamental skill that we need her to obtain. So it would be a lot of repetition, the same turn over and over and over again, so that she's obtaining that fundamental level of the skill and she's doing it correctly, and we're making sure that she's getting that correct position, that correct balance that she needs in order to be successful later on. Something that I would recommend, and which when this was taught to me, is some slow motion practice. I know that that sounds unusual because it is a moving action. To slow down a turn in slow motion, that sounds almost impossible. But what I mean by that is almost moving into segmentation, which is sort of similar. What we would do is, if Sarah needs to make a complete 360-degree rotation to make a full turn, we would break down that 360-degree turn into either a 90 or a 180. So Sarah would start at her front, and she would do a quarter turn of 90 degrees and stop. Then she would do another quarter turn and another until she made that full 360. And once she feels comfortable with that, we would do her 180, so she would only turn half the way, land, turn the other half. And what that's getting her to do is she's able to set up those correct body positions and biomechanics of the turn in slow motion, technically speaking, so that she's able to execute that full 360-degree turn later on as we continue learning. Again, I already kind of talked about error detection practice and why that's important. Something we might, for example, be doing, say Sarah's turning and she falls and loses her balance to the right. So as an instructor, I would say, okay, Sarah, you fell to the right. So what does that mean to you? And Sarah theoretically would be able to tell me, well, I'm balancing too much on the right. I need to push my balance to the left. So that's the kind of error detection practice that I'm talking about in this case. She's noticing what she's doing wrong, seeing that that is a problem, and learning how to correct it, which will serve her well later on in dance. That's a very important fundamental cognitive skill that we try and teach dancers. Something else that I would use is mental imagery. A lot of times when we're teaching this very basic skill, we like to tell our dancers to think about how they would be turning. We use a lot of images, like one of my favorites was a nail screwing into a piece of wood. So Sarah's foot that she would be turning on would be that nail screwing into the piece of wood. So I would give her examples such as that she can visualize herself being that nail sinking her foot into the wood, and that's going to help her practice and manipulate and be able to execute the turn correctly. Alrighty, progress. Dance is an art form, so it is hard to scientifically measure progress in dance, but something that I would do is I would measure it over a course of time. I know that a lot of times in rehab settings they do this with patients, so a patient goal or a way to detect progress is, okay, in a week this patient should be able to bend their knee this many degrees, because that is the average rate that a patient is able to get to this point. So we measure her progress over time rather than with something specific as a goniometer or a tool of that nature. So let's say the first teaching session, Sarah should be able to perform basic mechanics of the turn. And what I mean by that is maybe her arms aren't in the right place or her foot's not quite in the right place, but she's able to turn around in a circle and land and not fall. So that would be just a first basic teaching session, something that Sarah should be able to accomplish. Now in a second teaching session, Sarah should have accomplished the basic mechanics of the turn and the correct body positioning. So to me that means that Sarah's arm should technically be somewhere in the right place, her other arm should be in the right place, her legs should kind of be in the right place. They're not turned in, a pirouette turn, it would be turned out. If you need more of a visual reminder of that, I would recommend that you go back and watch the video. But What I'm trying to say is that she would have not only the mechanics, but she'd also be obtaining that correct body position, because that is going to actually help her with the mechanics of the turn. Alright, by a third session, Sarah should now be working on the balance that is involved in the turn. A lot of what people don't understand about turning is there is a lot of visual practice that goes in with turning. It's something called spotting. You're watching the wall as you're turning, and your head stays on a point. Your eyes follow the point on the wall as you're turning, and that's what helps you keep your balance. A more scientific way of explaining that would be visual proprioception, because Sarah is able to detect the movements in her body using that visual cue of, here's where I started, I'm able to see that my body is rotating around, I'm able to see that I'm getting back to the point that I need to land, and I'm landing. Or the optical flow concept that's also discussed in the book. And again, this point's just talking about as a particularly measurable art, giving a specific reasonable time frame allows for progress to be measured. So can't use a lot of tools to measure Sarah's progress, so we're going to use the tool of time, and that's going to be our measure of progress. Alrighty, feedback. This is quite a lot. Alright. In dance, it's very important as an instructor and as, to be in this instructional setting to give a lot of feedback, because this is a complex movement. Though it's a simple movement, it's a very complex movement. I would give her a lot of intrinsic feedback by means of exteroception that would occur visually, meaning that I would be able to tell Sarah, okay, you're not doing this correctly. Can you see how you're not doing this correctly based on what your body is doing? Because a lot of times there's mirrors in dance studios, so she would be able to visually see that she's not performing it correctly outside of her body. Knowledge of results, I would be able to tell her, okay, you landed the turn correctly, meaning she placed her foot down at the right time. That would be knowledge of results, so that would be a phrase that I would use, which is different from knowledge of performance, when I would say a phrase like, try and sustain the turn until the last possible second to land, because that's actually going to help her learn her balance, which is going to serve her later on as she moves into that motor phase. Example of instructional program feedback, I would say things like spot the wall, which we just talked about that concept. To keep her leg turned out, to keep her foot in the front. That's that instructional program feedback. Parameter feedback, I would be apt to say things like whip your head around faster, get your leg up sooner, try and turn slower, things that are going to be related to the time of her turning, because timing is very important in a pirouette turn, so I would be apt to say a lot of parameter feedback phrases. I would give her a lot of visual and verbal feedback. What I mean by that is not only just telling her, Sarah, you landed that turn incorrectly, it happened because you were doing this. That would be the verbal feedback. The visual feedback that I would give her, there's the mirrors like we talked about in dance studios, so she should be able to visually see what she is doing wrong, but I could also demonstrate for her visually what she's doing wrong by performing the turn incorrectly myself. So say that I gave the example of her falling to the right, I would show her how me placing my body in the incorrect position is causing her to fall to the right by also doing that same action. So that would be the visual and verbal feedback that I would be providing. Something that I think is very important is the prescriptive feedback. I don't think descriptive feedback is very useful, because you're just telling the person what they're doing incorrectly. So I would be more apt to give her prescriptive feedback by saying, well, Sarah, you are falling out of this turn, you're losing your balance, but to fix it, you need to improve your spot. To fix it, you need to get your leg up higher. To fix it, you need to balance more to the left. Those were the kind of corrections that I would provide her with, because as a learner, she's going to be able to take those corrections and apply them, rather than just sit there and keep turning, doing the wrong thing over and over and over again. By providing her with an alternative, she's going to be able to fix the turn, be able to learn the turn correctly, be more successful in the long run. Summary feedback, reviewing each attempt is something that I would be more apt to do. If I did the average feedback, she's just going to get an overall gist of problems. If I give her summary feedback, I can say, well, the first time you did it, you kept your leg straight. But the second time you did it, you didn't keep your leg straight. and show her why in the first time, by keeping her legs straight, she was more successful than the second time. So by comparing and providing that summary feedback of each time, she's able to see what she's doing correctly and incorrectly to put it together to get a more correct picture. I would also reduce the frequency of the feedback as she continues to progress. So say Sarah's on her 15th attempt at this turn. I'm more apt to talk less on the 15th attempt than I am the second or third. Why? Because I'm giving her the same information over and over again. So at this point, that's where we're going back to that error detection learning and practicing method that I talked about earlier. I want her to be able to take the feedback that I'm giving her and apply it cognitively. So by repeating myself over and over again, she's only getting the same message so many times. She's not absorbing it, I guess would be the correct word to use there. So as she continues on attempting, theoretically progressing in a positive way, I would have less to say. There we go. Modifications. So if things don't go as planned, this would be how I would adjust. So there's progress or there's lack of progress. If Sarah was progressing at a highly exceptional level, meaning first session she's getting the turn correct, she's doing it in a manner that the body position is correct, the timing is correct, the mechanics of it are correct, I would direct her to see if she could speed up how fast she could turn, because if you'll remember earlier, I suggested that we slow down the turn so that she is able to turn more accurately and it's more precise. So at this point I would say, well, Sarah, see if you can turn a little faster now. So if we follow the speed accuracy trade-off, earlier we deducted speed for more accuracy. Well, now we're going to increase the speed. Yes, her turn may be a little less accurate, but through time and practice, that accuracy will increase. Also, I might encourage her to go for a double pirouette. That was something that the girl in the video earlier did. She did actually a triple pirouette. It would be 2 revolutions for a double, 3 revolutions for a triple. So I would encourage Sarah, now that you've mastered this single pirouette, why don't you try for a double pirouette? I'm challenging her to see, yes, she's able to learn and master the concept of a single pirouette quickly, so can I challenge her and see if she can master the double pirouette as quickly, giving her something not only to work on, but also to strive for. And in that case, I would be giving more average feedback rather than summary, because if she's mastering that single pirouette, I don't have to sit her down and give her summary feedback from turn to turn if we're at the point that we're working on doubles. I would give her more an overall gist, because at this point her learning is telling me that she does not need that summary feedback from turn to turn because she's making correct error detection decisions. So I would just give her more of an average feedback. I would also increase my visual and verbal feedback. Just because if she's getting that double pirouette level, she's also going to need a little more visual cues from me, such as, this is going to sound strange because you can't see what I'm doing, but in a double pirouette, when you make this 2 revolutions, it has a certain timing to it, so I would help her give her that timing so that she's able to understand that that's the rhythm of the turn. So that would be verbal feedback. I don't know if you can hear that little sound that I just made, but that would be the rhythm of the turn that she would be making. Visually, I'm also turning my pen in my hand, which you can't see, but those would be the kind of things that I would be apt to do, is turning my pen in my hand at that speed and also making that noise. So learning goals not met, I would change my instruction level from verbal to manual. And what I mean by manual is, in dance, a lot of times we're very apt as instructors to manually manipulate our dancers to teach them the correct body position. So say that Sarah's not getting the correct body position, which is in turn deteriorating the level that she's able to accomplish this turn. I would manually place her body in the correct position, take her, turn her around in that correct position, and then set her down. So all I'm saying is that manually I would manipulate her body in a way that we would be able to together execute the turn correctly, so that she is able to precipitate and feel internally how that turn is supposed to feel. I'd also talked about segmentation earlier. If she's still not meeting those learning goals, we're going to stay with the segmentation and the part practice, because those slowing down of the turn is going to help her establish that correct balance, that correct body position, so that she's able to execute the turn as she progresses eventually. Also, slow motion practice. That's again that segmentation, that part practice. Excuse me, and also limiting to blocked practice. Should Sarah be progressing, as I talked about a minute ago, we would work more on varied practice, which means that I would place that turn in a dance combination. So she would do a step kick, a leap, and then do the turn. That would be the varied practice. We would only do that if Sarah was progressing exceptionally, but in this instance, Sarah's not progressing exceptionally, so we're sticking strictly with that blocked practice. Alrighty, in relation to the data, how these modifications relate to what I would see in the point that we talked about earlier in designing the plan, assuming Sarah is not progressing in the appropriate sequence within the given time frame, I would define this as lack of progress, thus altering my feedback and practicing methods as I just talked about. So Sarah, she's on the 3rd session and she's still not getting the correct body positions. That is the feedback data that tells me that I need to modify and redesign another plan and make these modifications so that Sarah is able to learn them correctly and get back within the correct time frame and progressing at the right stage, so that we can later on move into that motor stage of learning that Sarah needs to eventually get to. So, in conclusion, at the end of the instructional plan, Sarah has hopefully successfully learned the skill of the pirouette turn. And to review, these are just the steps that we took to get there. We diagnosed the learning situation and the characteristics of the learner. We did the goals of the learning, program learning, error detection. We talked about the task characteristics, serial, it's closed, open loop, and cognitive. We talked about the context in which we were performing this task. And then we designed the learning experience. We talked about the practicing manipulations, the segmentation, the verbal and visual cues. We talked about the goal-oriented activities. So what I mean by that is, how is me doing the segmentation leading to her ultimate goal, which we talked about before in designing the learning experience. And then providing feedback to enhance performance. So by telling Sarah, hey, you're not turning correctly because of this, your head's not snapping fast enough, your leg's not in the correct position, which is going to enhance her performance and she's going to be able to execute the turn correctly. And then we talked about the modifications, encourage a faster paced and more challenging movement if we're making a lot of progress, alter the feedback method and the practice methods if there are a lack of progress, and then use previous performance to alter feedback methods for changes. So that's just a brief overview of everything that we talked about. These are the sources that I used. I used Journal of Dance Education, I used Science of Dance Training, I did Motor Learning and Performance, the textbook, some information from the University of Tennessee in Knoxville. If you'd like to look at those, you're more than welcome to. And that is my presentation and instructional plan for my project final. Thank you. Have a great day.